feeling that feels like a good amount of time to wait. I'm going to get started, so we'll jump right in. So good morning, everyone. Happy Friday. I'm Marie Ellis. I'm the Public Policy Director at the Minnesota Council of Nonprofits, and you are at our mid-session legislative update. We've got 4 speakers today, so a little quick agenda overview. You'll be hearing from Elizabeth Emerson, who's our colleague at Goff Public, with kind of a broad overview of what's happening at the legislative session so far this year. Then you'll hear from Jesse Luevano, our colleague at the Minnesota Budget Project, going a little bit more in depth on the state's budget situation. I will then talk some about some proposals at the legislature related to state grants and contracts. And then we'll close out. We won't close out. Then we'll have Laura Mortensen talking about Medicaid and the impacts that could have, some changes could have on the state and on folks that you know and care about. And then hopefully we'll have some time for questions. A few notes about things. I'm a bit of a perfectionist. Those of you who know me are shocked, I know. And so I feel the need to note that this PowerPoint, while all the information is solid, may have some design flaws. And I just decided I needed to be okay with that to make sure that we could get all the important work done. So if you see design flaws, don't let that, cloud your judgment of the information. We'll be focusing largely on state issues today. MCN, of course, focuses on federal issues as well. You'll hear from Laura about Medicaid. And you can sign up for our nonprofit advocate newsletter. We cover both state and federal issues in that newsletter. We are recording the event, and that will be up for about 2 weeks. We've decided to only keep it open that long because things change so quickly. We want to make sure we don't have really old information out there. And if you have questions for the folks speaking, for the panelists, please put them in the Q&A function. If you want to chat with other folks or just make a comment, you're welcome to do that in the chat. So we'd love to hear from you and hear what you're thinking. Let's see, MCN's public policy work. So I have the privilege of leading MCN's public policy advocacy work, and that work fits into 3 main categories, just to give you an overview of kind of what we do. So we provide trainings to help nonprofits do your own public policy advocacy work. We have an Advocacy 101 coming up April 8th. That's gotten really good reviews, so hopefully you'll come join that if you're on the newer end of advocacy work. We serve as a resource to policymakers on the sector. When the funding freeze was announced back a month or whatever ago, we got calls from a number of federal offices and state offices saying, how is this going to impact nonprofits? What's going on? And we also reached out to share that information with folks who hadn't reached out to us. We do a lot of research as well on the sector and can share that information. And then finally, we advocate on issues that impact all nonprofits, and we give you all tools to advocate on some of those issues as well. So we're not able to work on all subsector issues like housing instability, animal safety, environmental justice, but we hopefully are supporting you all to do that. And we then are focusing on issues that impact the sector like, why can't I think of anything? Like tax exemptions for nonprofits, like government grants and contracts, like nonpartisan, nonprofit nonpartisanship, ensuring that we can continue to do our work in nonpartisan ways. Let's see, I said what we're going to do. I think with that, I'm going to turn it over to Elizabeth Emerson, who's the Senior Vice President of Public Affairs and Goff Public. And we've been working with them this session. And I've had the pleasure of working with Elizabeth for almost 15 years now. So over to you, Elizabeth.
Thanks so much, Marie, and thank you for the opportunity to work with MCN and to be here today. I see some familiar faces here, so it's really fun, and folks that I haven't connected with in some time, so it's really exciting to see you all. Pele, I think we can advance to the next slide. I'm just going to provide a high-level overview of the legislative session, as Marie mentioned. It is sort of hard to believe, but we are at the midpoint of the legislative session. It has been a rocky road, my friends, and if you have been tuned into any social media or kind of regular media, you know some of the background. I'm happy to answer questions, but I'm going to try to keep it as high level as possible. So on Monday, the last legislator, I guess, in the House was seated, the 134th member of the Minnesota House. So that has triggered the effect of a power sharing agreement between Republicans and Democrats. So we've only been in this mode for 5 days now, I guess. And so what that means for the rest of the session, gavels will rotate between committee chairs, so rotate party. So one day Republican, one day DFL. That is having mixed results in committees. Some committee chairs really are embracing bipartisanship, negotiating on all committee agendas. Some committees, will see a stark difference between the days when Republicans are chairing and the days when Democrats are chairing, and you'll see that the bills are very different. At this point, bills leaving committee must have a full majority of the membership of the committee to make it out. So there does need to be bipartisan support for every measure to get out of committee. And certainly when it gets to the House floor, it requires 68 votes. And currently the House is tied 67-67. So more to come, kind of how the House will function. At this point, they are mainly hearing policy and/or funding bills that are getting laid over. So there haven't been a ton of like votes happening. But in the weeks ahead, we anticipate that that will change, of course, as they need to work toward putting together a biennial budget. There has been a little bit of turmoil in the Minnesota Senate. You may have heard heading into this session, Democrats held a slim 34-33 majority. That changed this week when Senator Justin Eichhorn resigned his position just yesterday. So Democrats will hold a 34-32 majority, and I haven't looked in the last hour or so. I don't think we have seen the governor call for a special election in that Eichhorn seat. I would anticipate it stays Republican, so it is likely by the end of session we will be back to a 34-33, but the Democrats will maintain the majority there. That doesn't mean that it is kind of full DFL, full steam ahead. There is some friction within the Senate DFL caucus. We have the existence of a Blue Dog caucus who is maybe a little bit more moderate. This is the first year they have really formalized themselves as a caucus. And so we are seeing them kind of figure out what bills they are going to really stand hard and fast to, and where there is lack of alignment amongst the Senate caucus. So for all intents and purposes, they're kind of functioning as they would in a regular session, but certainly with some hiccups along the way. What we know is that work needs to pick up in a real hot minute because we have a combined first and second policy bill deadline of April 4th. And what that really means is that any bill that is straight up policy or is a finance bill that also has policy needs to make it through their committees of jurisdiction by April 4th. So they don't need to fully be on the House or Senate floor, but they need to make it through all of their appropriate committees. The third deadline, April 11th, that's when all finance bills must be out of their respective committees. And generally that has come to mean that anything, for example, an education funding bill, whether it is the large omnibus bill or a smaller bill, needs to be voted out of education committees by that time. And it needs to reside either in Senate Finance or House Ways and Means by that April 11th deadline. Now, with all good deadlines, they are in the eye of the beholder. And so there are lots of ways to get around them and many mechanisms to move forward legislation and spending proposals outside of those deadlines. But for the most part, we would anticipate that a lot of the omnibus bills or kind of large subject matter bills will move in accordance with those deadlines. They're currently scheduled to adjourn on May 19th. Which I think is optimistic. Many folks anticipate they may not be able to get their work done, and I'll talk a little bit about why in just a second, but that is their scheduled adjournment. They must adjourn on that date. If they do not finish their work of a biennial budget, the governor may call them back into special session. If the biennial budget is not passed by June 30th, the end of the state's fiscal year, we would go into a partial, I believe, government shutdown at that point. So I don't know that that's extremely likely, but perhaps I'm being very optimistic. Pele, we can go to the next slide. So we mentioned the closely divided legislature. The other kind of dynamic is we've seen Governor Walz kind of crisscrossing across the country, perhaps in a quest for higher office. But what it's really meant is that he is not kind of fully engaged or put his foot down on what his plans are for the legislative session. He certainly released a budget proposal in late January. At 11 o'clock today, he'll release a supplemental budget at 11 o'clock. So mark your calendars, and we've already started to hear some rumblings of what that might look like. But that's really it. We haven't seen, a lot of statements from the governor on state issues this session. We've heard a few things, but really it seems that the attention is distracted a little bit. Of course, Lieutenant Governor Flanagan announced her intention of running for U.S. Senate. And you've already seen, the governor is still fundraising outside of the Capitol, and we've seen the removal of Lieutenant Governor Flanagan from those materials. So they are kind of on their own trajectories at this point, and we don't see a lot of joint appearances for them. On top of all the politics, of course, the economic forecast is a little bit gloomy. I know Laura and Jesse are going to go into this a little bit more, so I won't steal any of that thunder, but it's not great. And today, I think we'll see a little bit more about how not great it is when the governor releases his supplemental proposal. There's a little bit of cash in this current biennium, but the horizon in the next biennium is pretty grim. So all that to say is that legislators will need to grapple with this, but really all they must grapple with is that FY 26-27 number. They don't, they call it the tails and kind of things in future bienniums. They do not have to end this session balancing that negative 5.99 that you see there. So they may try to, and certainly the governor's proposal does account. It has some cost shifts and cuts to benefits that would address some of that $5.99 billion projected deficit. But I would anticipate this legislature and the close division that they have will really focus just on how to focus on this biennium. What's up next is the legislative budget target setting. And what that really is, you kind of think of your grocery list, right? You have your dairy, your perishables, your vegetables, and the legislative leaders will need to set budget targets for committees so they know how much money they have to spend and or cut in their respective jurisdictions. So we anticipate the House, and again, with that 67-67 tie, we anticipate we may see budget targets from them by April 1st. I think that is kind of an optimistic projection of when we may see that. I think the Senate will probably lag just a little bit. We've heard April 5th, perhaps, for their release of budget targets that the Senate agrees to. It is not likely that the House and Senate are going to align in that thinking, and I doubt that either of them are going to be aligned with where the governor is at. So I think we will see three different approaches to kind of how to address the state's budget situation coming forward. We have heard rumors that the legislature is not going to consider inflation as they set their budget targets, which would make it a heck of a lot easier. It would reduce that 5.99 number. But there are many legislators who do believe you must consider inflation because it is a reality. So I think more to come on that. We've also heard rumors that the Senate may look at trying to attempt to address the future biennium budget shortfall. But again, more to come, but I think by early April, we will see those budget targets set in the House and Senate. We'll be able to compare them to the governor. Ultimately, all three of those parties, probably the legislature first, but all three of them must agree on some sort of framework. And generally, we call those joint budget targets, excuse me. And I think it will probably be mid-April before we see any real alignment of those three. I think we're going to see pretty different approaches in how they want to tackle the budget. Pele, we can go to the next slide. So where are we going? A couple just kind of observations that I've had about session is aside from the politics, right, which are always kind of crazy, this session just feels really frenetic, that we're kind of playing whack-a-mole, lots of different proposals, no real theme. And I think that's because there aren't giant issues driving session. You think of the past couple sessions and we've had paid family leave, cannabis, like all of these really hefty issues that kind of frame the session and serve as the momentum for session. And all other issues tend to be influenced in some way by these giant things happening. And I think because of a lot of what has happened, and there just aren't those issues. Democrats really are in the mode of protecting what they did last biennium, and Republicans are firmly in the mode of undoing what happened last biennium. And there aren't, it could happen, and certainly the federal kind of cloud is something that is out there and is casting over, but no one really knows what to do about it. So it's not like there's a bill to address the federal action. So there aren't, again, those big driving issues, which really does kind of take a toll on this frenetic pace that we're seeing. Certainly, and as we'll talk about, these themes of waste, fraud, and misuse are, they play well in the public. We've certainly had some high profile issues here in Minnesota that have driven that narrative. But if there were one issue kind of driving, I would say it's this. But honestly, as you talk to more Democrats, moderate Republicans, like they all know it's complex. And again, they don't really know what to do with it. We have a few big proposals related to additional oversight. The governor has an element of his budget that's addressing kind of this waste fraud issues. But it isn't clouding into other issues like I kind of expected it might, because it just really is like the one thing that everybody is talking about. But I think there's recognition that it's really tough and complex, and it's not just a thing when you talk about waste, fraud, and misuse. It's multifaceted, and certainly not only a Minnesota problem. There's interactions with the feds as well. So kind of speaking of that federal interaction, I think there is pretty broad recognition at the state level that by May or June, they need to tend to their knitting and solve their biennial budget. But there is a giant asterisk on it. And I think many people suspect that the legislature will need to come back in summer, fall, whenever more is known on kind of the federal budget decisions. And to the extent that it has a detrimental effect on the Minnesota budget this biennium, I think many people recognize that we will need a special session later this year to resolve those issues. I don't think, if that were to happen, I don't think this is a situation like we saw during COVID where just a bunch of issues kept piling on. I think they are really going to try to solve as much as they can during this session. And when they come back to any special, it will really be focused on federal government interactions and not like random issues that try to get shoehorned in there. I think with just the closeness in the divided government, I think that will be the case. Pele, I think we can, I think that might, oh, we have one more slide. Yeah. So just kind of speaking of our work, Marie mentioned that we are working together this session. And so just wanted to provide a little bit of insight into kind of how we are starting this work. We know we're going to talk about many of the pieces of legislation that are driving our work, but also one thing we're doing is really just trying to be kind of boots on the ground and eyes and ears with legislators and provide a venue for them to talk about what's on their mind in this space and kind of how the state government interacts with nonprofits and the important services that they provide to state government, or actually to citizens or residents of Minnesota, and kind of how they are amplifying policy priorities that the state has. So we have been focusing and starting with certain members of the legislature based on their committee assignments. And then also if they are authoring bills that we'll discuss a little bit later. And that has really been a great, the conversations have really been great. I think legislators are excited, number one, when we sit down and say, hey, we're the nonprofit sector and we're here to help. Like, what ideas do you have? They just appreciate being able to think through that and understand a little bit more about how some of these like headline issues might affect nonprofits of all sizes. And so giving them a space to do that while they're not kind of directly speaking to a single nonprofit gives them a little bit of flexibility in how they're able to talk to us about what's on their mind. And so that's how we have been approaching it. And then working with the legislative leaders, there's a few groups of bipartisan groups of legislators meeting, and we are really asking them that as they get to final decision making, that MCN should have a seat at that table so they can better inform the work that they do and the final decisions that are happening. So I would say at this point, it's a giant pot of stew that continues to kind of churn around, and we're part of it. And once that stew starts to go into the bowl, I think we're excited that we may be a spoon, fork, knife, or something that helps shape how that ends up getting delivered to Minnesotans. And so thank you for the opportunity to be part of the work, and happy to take any questions. And if I don't know the answer, I will tell you that I don't know. So thank you so much.
Excellent. Thank you, Elizabeth. That was really helpful overview. Really appreciate it. And with that, I think I'll turn it over to Jesse Luevano at the Minnesota Budget Project to go a little more in depth on the state's budget situation.
Awesome. Thank you, Marie. And I think we can go to the next slide. One more slide. Yes, perfect. Okay. Hi, everybody. My name is Jesse Luevano. I use she, her pronouns, and I'm a policy analyst with the Minnesota Budget Project. For background, the Minnesota Budget Project is an initiative of the Minnesota Council of Nonprofits. We're a research and advocacy nonpartisan organization focused on equitable and just public policies so that all Minnesotans have what they need to pursue full and free lives. Our work is primarily in tax, budget, and economic policy, including affordable healthcare. So for this presentation, I'll be talking about what the February forecast is, what it's used for. I'll get into what this specific forecast tells us and end with some 2025 legislative session implications and key takeaways. So staying on this slide, what the forecast is, it's put together by Minnesota Management and Budget. It uses current law and makes informed predictions, I'll underline that word again, predictions about the economy, state revenues, and state expenditures. And this specific forecast takes into account some possible federal changes, such as domestic tariffs, retaliatory tariffs, tax cuts, and deportations. These federal actions contribute to higher inflation in the model for 25 and 26. And so we'll see the impact of higher inflation estimates when we dig into the numbers. But the forecast doesn't account for the full spectrum of federal actions that could impact state budgets, kind of like Elizabeth was talking about earlier. So, for example, if budget responsibilities shift from the federal government, individual states have to take on a bigger role to fill funding gaps for essential services. And so I'll ask Pele to go to the next slide so I can talk about Medicaid as an example, and then we'll bounce back to this slide again. So sorry for keeping you on your toes. So this is slide 19 from Minnesota Management and Budget PowerPoint presentation. They make a PowerPoint about the February forecast, so I'm using their expertly put together slides. So slide 19 shows that a large share of medical assistance, which is the state's name for Medicaid, is funded through federal dollars. And you could see that in that kind of dark blue shade on the pie graph. And these dollars make up a large portion of the state's projected revenues for fiscal year 26-27. So this pie chart shows projected revenues, and you can see how much of that is federal Medicaid funding. And a reduction in these dollars would likely have a big impact on Minnesota's budget. So we'll bounce back to the previous slide now. All right, and the economic model does not take into account federal action after the forecast was prepared. So the federal landscape is quickly and consistently changing, and this forecast captures predictions made in a moment in time. And then this February forecast looks at 3 different biennia, and biennium is just the name for 2 years grouped together. So looks at fiscal years 24 and 25, which are the fiscal years that we're currently in. Looks at fiscal years 26-27, which are the fiscal years that policymakers will set the budget for in this legislative session. And then fiscal years 28-29, also called the out years or the planning horizons. And numbers for the out years have more uncertainty because they are further away. So what the forecast is used for from a policymaking perspective, it's a tool for all of us to understand the budget baseline. And it's also a tool for policymakers to be informed about the state budget. So it will be used to inform the governor's supplemental budget that comes out today, and will also inform legislative targets that policymakers will set the budget this session. And then we can go to the next slide, and then the next slide again. So skip the, yes, one more. Yes, perfect, thank you. So some backdrop from the last budget setting session in 2023. So the biennial budget is set every 2 years. It's set this year in fiscal year 2025 or in 2025. Last time it was set was in 2023. So budget decisions made in 2023 used unprecedented budget surpluses to fund transformational policy changes, begin to make up for years of underfunding, and respond to real problems everyday people face. And much of these unprecedented surpluses were temporary. And policymakers responded to that in part in the budget decisions and used it for temporary spending. So for example, early learning scholarships is a program and important resource for lower income families to be able to afford childcare. And early learning scholarships received a one-time appropriation over base funding. For fiscal year 24-25, it was roughly $252 million. And so this is an example of surplus dollars being used as one-time spending to address an ongoing problem. In this case, the ongoing problem is affordable childcare. And so this one-time allocation creates a funding cliff And funding cliffs of this nature are something policymakers will likely have to consider when making budget decisions. And then zooming out, roughly $9 billion of fiscal year 24-25 new spending was temporary. And so the state budget balanced through the end of fiscal year 2027 through the use of surplus dollars, but it was structurally imbalanced in fiscal year 24-25 and 26-27. And so a structural imbalance is created when spending is predicted to outpace revenues. So in fiscal year 24-25 and fiscal years 26-27, this imbalance is not considered a deficit because one-time dollars, largely from COVID era, are still making up for that spending revenue gap. All right, and then we can go to the next slide to get into what this forecast shows us for fiscal year 26-27. So again, using a slide from Minnesota Management and Budget. So to orient you, the left column, fiscal year 26-27, that's what the November forecast said, which was the forecast released prior to this February forecast. And then the middle column is what this February forecast says, so the most updated numbers. And then the column all the way to the right is the forecast change, so the changes between the November forecast and the February forecast. And I'll also draw attention to the fact that these numbers are in millions. So as you could see, there's a smaller positive balance for fiscal year 26-27 than the November forecast, and higher anticipated inflation and slightly higher spending are drivers. So if you look at the budgetary balance line, the fiscal year 26-27 biennium is forecast to have a $456 million positive balance at the end of biennium. And this is $160 million less than the 2024 November forecast. So compared to the November forecast, revenues are up. You could see this in the total revenues line, projected to be $640 million, or about 1% higher than November forecast estimates. And then looking at looking at spending within that green box right there, just the spending without discretionary inflation. For fiscal year 26-27, it's projected to be $570 million, or about 0.9% higher than 2024 November forecast estimates. And then inflation is up. So looking at that discretionary inflation line right there, you can see that it's projected to be $219 million, or 24% higher than November forecast estimates. So this forecast also projects $1.1 billion in discretionary inflation for fiscal year 26-27. And you could see that in that discretionary inflation line within that green box. And this amount does not automatically go towards individual programs to keep up with inflation. Again, policymakers can allocate these dollars towards any purpose. So with the looming deficit, this is especially important to keep in mind. And a little bit more about discretionary inflation. So discretionary inflation is an important tool for the forecast. It makes the forecast more useful by helping us understand the impact of inflation on cost and service provision. And discretionary inflationary estimates are applied only to programs that do not already have inflationary increases built into current law formulas. Some programs already do automatically adjust for inflation within their current law formulas. So lots of numbers, but the big takeaway from this, the big thing I want you to walk away with, is that in 2025, policymakers will make decisions about how to allocate the $456 million positive balance and the $1.1 billion in discretionary inflation. So for a total of about $1.6 billion. And then we can go ahead and go to the next slide. So this is the longer term budget outlook. So it's what the forecast shows us for fiscal years 28 to 29. So like I said before, these planning estimates are a little more uncertain. They only compare revenues coming in that biennium to anticipated spending. So there's inherently a higher risk of uncertainty. And then in these fiscal years 28-29, there's a projected negative $6.5 billion balance in fiscal year 28-29, and that includes $2.5 billion roughly of discretionary inflation, and you can see that within that green box again. So without discretionary inflation, you can see on this bottom line right here, it's roughly a $4 billion negative balance by the end of fiscal year 2029, and these figures do not include any positive balance carrying forward from fiscal year 26-27. So these figures assume nothing carries over. All right, let's go to the next slide to talk about some 2025 session implications. So the legislature must pass the budget for fiscal year 26-27, and it needs to balance. They don't have to balance the budget for 28-29 yet. They have $1.6 billion available for funding things above the forecast baseline, which is the combination of the surplus and discretionary inflation lines. But policymakers will also be mindful about how these decisions impact fiscal year 28-29. And there are still a couple of questions about how policymakers will respond to a few things. So funding cliffs from one-time fiscal year 24-25 spending and the ending of COVID era funding sources, questions about big federal changes, and then any other emerging issues as well. And then I have one more slide with a couple of ending notes. So this forecast, yes, okay, perfect, right side. So this forecast is based on current law, again, and while this forecast accounts for some possible federal changes, it does not include the substantial impact from the expected federal budget cuts and funding to states and local government, healthcare, food support, and other essential services. Minnesota will need to act to protect folks from the harms of these cuts. And then Laura will talk a little bit more about the federal Medicaid fight, but again, the federal Medicaid defense fight is everyone's fight. Not only because access to healthcare is important, but also because of the large portion of the state's budget it makes up. And then from the Minnesota Budget Project perspective, our experience is that in the past, when the state has faced a mismatch between revenue and spending, the problem was only fully solved by raising additional revenues to balance the budget. So as the Minnesota Budget Project, we want raising additional revenues to be part of the conversation. And then finally, it's still essential for advocates to continue to make requests to policymakers. It's very important that people continue to make their priorities known, keep organizing, keep advocating, and keep making your needs known. Thank you for your time.
All right, thanks, Jessie. When I first started lobbying in Minnesota and I didn't know anything about how state budgets worked, I'd always turn to the Minnesota Budget Project to get trainings on the budget, read the blog posts and all that stuff. So highly recommend it to everyone who is here. The Minnesota Budget Project again. Haley, next slide, please. So Elizabeth mentioned, unfortunately in the news, we have seen a lot of fraudulent use of state dollars. Now, the nuance there, of course, is that it has not largely been done through the state's grant making and contracting system. However, that is what legislators assume needs to be fixed then. And so we're seeing a lot of proposals to reform the way the state does grant making and contracting. It's all to prevent fraudulent use of state dollars. And so the nice thing is we're totally on board with that, right? I imagine everyone on this call is like, yes, I would like my tax dollars to go to its intended purpose, right? So we can start high level when we're talking with legislators and others that we really do have the same goal. We just have to figure out how to make that goal happen. So I organized the content that's coming up around pieces of proposals rather than the bills themselves. Because likely we will see pieces of these different bills pulled out and put either in omnibus bills or another, a standalone bill, something like that. So the bill numbers are a little less important than the ideas. All right, Pele, next slide, please. All right. The first one I'll talk about is a proposal that we've seen, I think every year since I've been at MCN, so about 6 sessions and well before that. And it's a bill to prohibit any state grants or contracts to nonprofits if any employee is paid more than either 125% or 100% of the governor's salary. The Senate version had a hearing this year. MCN testified against it, recognizing that there is a labor market and that in order to, continue to have experienced and talented people in leadership roles, we need to play well with others, right? We need to pay what the going rate is in the labor market. This one, it comes from, in my opinion, it comes from this idea that nonprofits should really all be volunteer work, that we shouldn't be getting paid. Legislators largely don't see nonprofit work as a career and a way to make money. I'll note that there are many, many state contracts with for-profit organizations where executives make well more than 125% of the governor's salary. So it really is an issue with nonprofits specifically. And one thing we hear often is like, well, the executive at this nonprofit makes $500,000 a year, and we just gave them a grant for $500,000. And so they kind of equate those two as if all the state's money is going to pay one person's salary. Also, there are so few nonprofits where the head person makes $500,000. You all know that. I said that number and you were all like, oh, nobody here makes anywhere close to that. I'm well aware. And just a bit of a note, the governor's salary this year is around $150,000 to give you a sense of scope. Next slide, please, Pele. The next one is one that really bothers me. We saw this back in 2022, and it's a proposal to prohibit all state agency employees, which is tens of thousands of people, and all elected officials at any level, so township board up to US senator, from being voting members of a nonprofit board. They're trying to resolve conflicts of interest, I think. I think there are better ways to do that. There are ways we could, pull out a piece of that. But generally, good nonprofit practice is to have conflict of interest policies and to abide by them. And if an elected official worked on, had access to an issue that's relevant to their nonprofit, we would hope that they would recuse themselves from that vote. That's what should be happening. So it seems like a bill that would make it even harder to find board members, which all you EDs out there are probably very familiar with that issue. Next slide, please. Next issue I'll talk about is unannounced monitoring visits. This is actually in two different House bills right now. It started in House File 2, and then it was added to House File 1. House File 1 is the Office of Inspector General bill, and I'll get to that later. But it would require that state agencies do at least one in-person unannounced monitoring visit for every grant over $50,000. And it says twice in the bill that it allows for no exceptions. So we've been talking with the bill author about that, explaining that monitoring visits are, it's a term of art used by the state. It has specific requirements of things that the state staff need to be looking for, asking for, talking to. And so if they show up unannounced and the staff they need to talk to aren't there that day, I mean, talk about waste, right? That's a waste of a lot of folks' time. And there are some grant programs that are done completely virtually, right? And so it would be impossible to do an unannounced monitoring visit. So we think that the author of that bill understands that, and hopefully in a future version, we'll see that backed off a little bit. Where this comes from is the idea that Feeding Our Future fraud would have been stopped if a state agency staff person had just had to drive by a site, right? They would have seen no kids there, no kids eating, must be fraud, right? It's a very simplistic view of how this could work, but you can see kind of where the idea comes from and why it seems like a good idea. A lot of these bills seem pretty reasonable upfront. And so part of our job is explaining to legislators the unintended consequences that some of these would have. Next slide. All right, financial audits. So currently, any nonprofit in the state with annual revenue over $750,000 has to conduct an annual external financial audit. So hire a CPA firm to do such an audit. They're very expensive. They take a lot of staff time. Overall, fine, right? Like audits are a good thing. It's not a problem. But there's a bill, and this bill we saw in 2022 as well, that would require, if a nonprofit gets 50% or more of its funds from state revenue, that they need to have an external financial audit. The problem here is this is only going to impact small nonprofits with revenue under $750,000, because otherwise they're doing it already, right? One of the examples in 2022 we were able to provide was a group called Living at Home. One of their sites in Greater Minnesota had annual revenue. I might get these numbers a little bit wrong, but it's close. Annual revenue of about $80,000. And a big part of that was a $50,000 contract with the state. It's to help elders stay in their homes. So they would have fallen into this, and they would have then had to use $10,000 to $15,000 of their $80,000 to get an external audit. So the point we're trying to make is that overall, the amount of funds that they're trying to oversee is not anywhere close to the amount of funds that could be the amount of, it's not, how do I say that? It's a very small piece of the charitable revenue pie. And if we're really trying to go after finding fraud, waste, and abuse, it's not going to be at these organizations, and it's not going to be large sums of money. So we want to make sure that we're against that. I did not say that one very well. Next slide, please, Pele. This one is, so funding to create an Office of Inspector General. Generally, MCN is pretty neutral on this bill. There is an Office of Grants Management, but they don't have the same authority that an Office of Inspector General would have. I saw a question in the chat, I think, about data and what access to client data an OIG might have, which is a really great question. And I'll look more into Elizabeth's answer later as well to make sure I'm up on it. One of the problems with this bill is that it proposes to use 1% of all grant and contract funds to to fund the proposed Office of Grants Management. 1%, you know, it's a little hard to argue against because it sounds so small, but that's 1% less that the state agencies have to recruit nonprofits to apply for programs and to have staff who are overseeing programs. And it's 1% less for the nonprofit to do the work that they're contracted to do. Next slide. Okay, what can you do is what we're going to talk about next. If your organization has a state grant or contract, please talk to your legislators about it. You can do that through a meeting at the Capitol. You can have a virtual meeting. You can send an email, leave a voicemail. I mean, find them on TikTok. It doesn't matter the platform at this point. We just want you to talk to them and explain the process, right? Like, how did you apply? Were there any issues with the application process that were difficult? How long did you spend on the RFP? What are your reporting requirements look like? One of the things we've heard a number of times is legislators saying that nonprofits are totally unaccountable to these funds. And they have in their mind that a grant means the state agency just writes a check. Here you go, nonprofit, go do what you want. And we all know that that's not true at all, right? That there's application process, there's pre-award risk assessments, there are all the evaluations you need to do. And so let them know what that means, what a contract for services looks like, and that it's not just a grant of money, right? If your organization has decided not to apply for a contract that would have been a good fit because you've heard that working with the state, contracting with the state can be difficult, let them know that the state is missing out on some great potential partnerships. Let's see. Next. Oh, yes. Oh, I know, last thing on this one, sorry. I think Pele can put in the chat a link to our coalition. Oh, and he put some other great tools there as well. Thank you, Pele, for meeting with legislators this year. We have a group of folks who are interested in grants and contracting reform. And so we'll put the link there. You can sign up there. We'll be sending updates. We haven't been doing it as much as I would like, but we'll be sending one probably later today, updating folks on where these different bills are at so people can sort of come alongside with us. So join that group if you want. There's no expectations for joining the group. There's some questions because we want to get a sense of who is there. But at this point, it's really just signing up to get information. And we may have an action alert at some point, but you're not like signing your organization up to do anything. Okay, with that, I am going to turn it over to my wonderful colleague at the Minnesota Budget Project, Laura Mortensen, who will talk to us some about what's happening with Medicaid at the federal level.
Awesome. Thank you so much, Marie. And hi, everybody. Laura Mortensen, I'm Communications Director at the Minnesota Budget Project, and basically sharing with you how we're working in coalition with healthcare advocates to defend against these large, harmful cuts to Medicaid funding and eligibility that you've probably heard about. And really importantly, how you as nonprofit organizations and your networks with Minnesotans and in community can support that advocacy. So I'm basically making a case of why it's so important that all of us are working together toward this. I do want to start just by sharing a reminder about our shared values around healthcare, and that Minnesotans truly understand that being able to afford healthcare is an essential and basic right, and that all of us deserve to afford our medicines and take our kids to well-check visits and get all the other care that we need. But that health and well-being of nearly 1.4 million Minnesotans are at risk if federal policymakers proceed with their agenda to severely cut Medicaid funding and eligibility. So in Minnesota, if you don't know, Medicaid is called medical assistance, or MA, and those 1.4 million Minnesotans are babies, they're pregnant people, they're children, they're students receiving mental health care, adults living on low incomes or maybe in between jobs. There are people with disabilities, and there are older adults and neighbors in nursing homes or getting care supports at home. Medicaid covers more people in the state than Medicare, and more people than any single commercial insurer, which means that medical assistance plays a key role in the state's low uninsurance rate of 3.8%. Medical assistance covers 3 out of 10 births in Minnesota. It insures 592,000 children, or about 41% of our state's kids. Minnesota's Medicaid provides 20% of all mental health treatment in the state and covers half of long-term costs for Minnesota. It is Medicaid, not Medicare, that is the primary source of coverage for people who need long-term care services like nursing homes. But about 4 weeks ago, the U.S. House of Representatives passed a budget resolution to cut at least $880 billion over 10 years from the Energy and Commerce Committee's budget line items, which is a target Republicans indicate they will hit primarily through cuts to Medicaid. So 8 years ago, Minnesota health advocates came together under the name of This is Medicaid to fight the cuts to Medicaid that would have come through the proposed repeal of the Affordable Care Act. So once again, back in December, Minnesota healthcare advocates renewed their commitment to join together across issues and priorities to ensure that Congress does not take healthcare away from Minnesotans. And among the things that this Medicaid coalition has done since coming together includes sending letters to our Minnesota's congressional delegation and to Minnesota legislators and the governor, which is important, as you heard Jesse say, because these proposed federal cuts to Medicaid funding, if enacted, will really create a giant, large hole in the state's budget. And there are very few ways Minnesota policymakers can fully protect medical assistance and the vital care and supports it provides. So this leads me to my final point, that nonprofits and regular citizens across Minnesota have an important role in a couple of ways. If you are in the direct service space or advocacy around healthcare or food security, the federal funding cuts will be felt significantly. And at the same time, we can expect to see additional increases in healthcare and food security needs in all of our communities. And even if you're not in the healthcare advocacy or delivery space, because the cuts to federal funding that the state receives would be so large, other vital public services that the state pays for will also be threatened. So think of all the other types of nonprofit organizations serving our communities, many of you in the room. These are arts and parks and childcare and the environment and many more. If you get state funding, those funds are going to be under threat. So we've been speaking out to nonprofits as often as possible, encouraging organizations to engage with their networks and in the communities that you're located, and really do their part in educating and raising awareness among Minnesotans who need to know what's at stake with these big changes happening at the federal level. Just last week, I was in a meeting with the governor's office where folks expressed the need for a broad public awareness about these threats. So we're urging you to help us to play a role and help us get the word out. And we've got resources. On Minnesota Budget Project's website, our Get Involved page, we have a communications toolkit for organizations like yours to share social media posts. We have fact sheets, we have talking points, and we also have a live action alert for individuals on our Get Involved page, which you can share out as well to encourage your networks to send a letter to their congressional representative. And we're going to continue to build out those communications tools and adapt to the changing landscape, and then share them through a variety of communications tools, both through MCN and through the Budget Project. So I just want to say thank you for having me here today, and really thank you for being here to learn more about this time that we're in. It's really tense, it's intense, it's confusing, but I hope you also, like me, are encouraged by seeing us all together here today, because that's really how we're going to get through this. I'll drop a link in the chat, and I'll hand it back to Marie for Q&A.
Awesome. Thank you, Laura. I appreciate how you were able to talk about the individual impacts of Medicaid, and that like 41% of our state's kids are covered under Medicaid, and the fact that these potential large federal cuts would have a massive impact on the state's budget, which then is going to have ripple effects in so many other things. So thank you so much for that content. Paley, if you can move to the next slide. We're almost up to questions, folks. Well, just a few minutes. We've got some upcoming events. So you'll get oh, Paley put all the links in too. So you're good to go. But we have an introduction to state grant making in Minnesota coming up. That could be of interest to a lot of you. And then we also are going to do, I'm just highlighting a couple, another member briefing. We did one last month, but we'll do another one of those on May 7th, and we'll have some legislative session content there as well. And with that, I think, Paley, can you take down the slides? And then I think we'll just open it up for questions. So folks can ask questions in the Q&A feature, or if you'd like, you're welcome to just unmute and ask your question as well. And actually, I see a question in the Q&A, so I'm going to ask it. And this is to Laura. Is there a source outlining how the Medicaid cuts will hit each individual state?
Yes. I can look really quickly in our source or our my resources, and I'll try to just share it in the chat. We really rely heavily on the Center on Budget and Policy Priorities. So if you're not following them, or I would encourage you to do so, and then you can follow us as well. But let me do a quick look and I'll find that out.
Cool. Thanks so much, Laura. Other questions? What are people wondering about? I'm really bad at waiting, but I'm trying really hard.
Good morning,
Ron,
Marie.
you unmuted. Good morning. What are you thinking?
I did. I dropped one question in, and this was just going back to Elizabeth's. I apologize. I joined late. I heard the governor's budget, revised budget coming out today, and then we were talking about legislative budget targets in mid-April. Was that for the joint targets, or is there an interim date where we expect the legislative targets to come out prior and then they're working towards the joint?
Yeah, John, I think we'll probably. So House rules indicate that they need to come out with budget targets by, I think, April 1st or 2nd. I can't remember which it is, but it's about 10-ish days from now. So House rules say that. So I think we'll see probably the House targets first, then the Senate targets. I can't imagine they're going to be the same. So I think they will try to fairly quickly reconcile those. Whether they can get agreement with the governor for like full joint budget targets by then, I don't know. I don't think we'll see a case where it's like the legislature versus the governor. I think they'll move pretty quickly, the House, the Senate, and then come with joint. I don't think we'll see like legislative targets and then the governor, and then they try to go at it. So I would say mid-April for those joint targets with the governor.
Okay, thank you.
Yeah, thanks, Elizabeth. And I'll just add that the targets don't often get a lot of news coverage, I think, because initially they don't mean much, right? It just means that each committee essentially gets a certain amount of money that they can spend on things under their committee's umbrella. And so right away, you can't say, well, oh, the target means they're going to, use it for these things. But it is super important. It took me quite a while of lobbying to understand just how important the targets are. So definitely something to pay attention to. What else are people thinking about? We did such a good job. Nobody has questions. Oh yeah, here's a question in the chat. Elizabeth, I'll have you answer this one. Can you confirm again what has to pass this year?
Sure. So really all that has to pass is a 2-year budget that addresses fiscal years 26 and 27. So that is all they really need to balance. There's no requirements for a bonding bill. There's no requirements that they actually address that projected deficit. It's really just the next 2 years budget cycle that they need to pass. And again, their session ends on May 19th. I think in an ideal world, they would have it done by then. However, the real deadline is June 30th, when our fiscal year ends. So the state would not have authorized an operating budget moving forward. So that June 30th is really the deadline that they need to get things done to move forward.
I have a curiosity. For those of you who have met with your state legislator, either senator or House member in the last year, would you go to the react button and do either like a thumbs up? Yeah, let's say a thumbs up. I'm just curious to see how many folks are meeting with legislators. Thanks, Sam. I can't see both pages at once. I'm trying. Okay. Nicole, Serene, Larissa, excellent. Pam and Sarah. Dave, Yvette, Steve. Okay, excellent. Thank you to everybody who has one of those. Thank you, Amy. We get asked every once in a while, like, how do we fix the narrative at the Capitol? How do we make legislators understand the great work that nonprofits do? And MCN alone, we cannot do that. But there are so many incredible nonprofits, and if each of you are out talking to your legislators, that will change their minds about what nonprofits do and give them a new idea in their heads of what a nonprofit in their district looks like. So highly encourage, even if it feels nerve-wracking, you could send an email if it feels nerve-wracking, just introducing yourself and the great work that you do in their district. Any last questions?
Marie, there's another question in the Q&A about how much influence the Minnesota legislature has lobbying the federal legislature. And kind of with the comment that it sounds like they are exclusively reacting to federal decisions. So I would say we have seen, I think, some legislators kind of weighing in on very publicly on kind of federal actions. I think notably we saw some Republicans take an outward kind of position on the proposed Medicaid cuts and kind of indicating what that would mean here in Minnesota. I would say it depends. I would say of our Minnesota congressional delegation, I think, they do look to state legislators as kind of the closest eyes and ears to constituents that they have. However, there is kind of the seniority complex or power complex, right? That once someone goes to Congress or Senate, that like, I know better than you, little lowly legislator, particularly on federal issues. And I would say the political dynamic is just heightened to a nth degree. That makes it a little bit higher stakes for them to kind of stick with their team, whichever team that is. So I think it depends. I think if there's already a close relationship between that state legislator and their federal counterpart, I think that does have some influence. And certainly, so if it's a member of their own party, either helping push them in a new direction or fortifying where they're at, I think it is helpful. And I think if they're certainly in numbers, if there are state legislators gathering with the same message and pushing on members of the federal delegation, I think that does help. There's some kind of mixed feelings on kind of how Minnesota may be treated at the federal landscape with kind of our governor and just having a Democratic governor. We have the distinction that our governor ran against the current administration for office. So there is some chatter that, that puts maybe an outsized target on Minnesota a little bit. But I think certainly, our Democratic federal representatives are very aware of that, and they hold a lot of seniority in DC as well. So between Representative McCollum and Senator Klobuchar, I think that ain't gonna happen on their watch, right? So I think there is, and I think when it comes to kind of similar parties, I think they can influence each other quite a bit.
Thank you, Elizabeth. That was an excellent answer. With that, I think we'll close out. I just want to make sure to highlight two things in the chat. One is our feedback form that Pele posted. This is the first time since I've been at MCN that we've done a mid-session update. So really curious if it was helpful. If it was not helpful, then we don't have to spend time on it next year. But hopefully it was helpful, but it would be great to know that. So please do complete that form. And then I also want to highlight Steve's comment that he just put in the chat. That legislators are not looking for you to be experts in legislative advocacy. They know that you are the expert in what you do, and that's what you're there to talk about, not about, specific legislative things that legislators know about. With that, I think I'll just thank all of our speakers again. I think this was pretty informative. Hopefully others agree. And we're all in this together. Keep that in mind. And hopefully everybody can get a little bit of rest and renewal over the weekend. Have a good Friday. Bye, y'all.